Hello students of class 8, welcome to the online tutorial classes for Vidya Bhavan High Secondary School. So it is the biology video and the chapter what I will continue today is the health and hygiene, and this is the part 14 video. So in the previous video we started with the first aid and we continue with cuts and bruises and the burns and the bites and stings. Today I will continue with the bites, like the first aid for the poisonous snake bites. Okay. First aid for poisonous snake bite. What are the things we have to follow if we get any cut from this poisonous snake? Like while bites of non-poisonous snakes do not require medical treatment, bites of poisonous snake can only be treated with anti-venom serum because the poisonous snake have venom on the tip. Before administration of the anti-venom serum, immediate first aid should be given to this victim. It is very important and it can save the life. Firstly, keep the patient calm as panic enhances the heartbeat rate, which circulates the venom faster in the body. Secondly, never try to assess whether the bite is from a poisonous or a non-poisonous snake. As some snake bites take time to take effect, consider all snake bites as poisonous. So we don't have to think that if the snake is poisonous or not, or just we have to think that it is poisonous, it's a poisonous bite, and we have to continue the fast weight. We have to initiate the fast weight along accordingly. Like clean the wound with an antiseptic lotion. Do not use the potassium permanganate at all. So to limit the spread of the venom, bandage the beaten limb firmly with a splint and immobilize it. Do not use the tourniquet as the stop flow to the blood completely. This can lead the amperature of the affected limb. It is very important. So we have to tie the bandage firmly. Do not do like so hard like the blood can't flow through these veins. Do not give alcoholic drink to the victim. Do not give any food and water to the victim to keep the rate of the metabolism low. Try to draw outline of the venom within 5 minutes of the bite. So we have to draw an outline like that. Like if it is the cut, we have to draw an outline like that. Okay. Use standard structured devices that are now commonly part of standard snake bite first aid kit. So we have to take one standard snake bite first aid kit to treat that victim. Okay, so next is for the first aid for stings of insects. First aid for the stings of insects. Okay, certain insects such as honeybee or wasp sting, when disturbed, this give enormous pain and discomfort. We all have this experience, I know you also have. So in this case, keep the person calm and remove the string with the help of tweezer. Tweezer is a thing like that, like these two fingers. By this we can actually point it out the string and take it like that. With the help of an adult, scalp the area or the skin with a blunt knife and do not cut. You have to scalp that area but do not cut. Wash the area with soap and the cold water. Apply oil or Vaseline and cover the area with a sterilized gauze. Apply ice on this area swelling due to the string. So we can actually use the ice for reducing the swelling. Next, the object in an eye. Like if any object fall in the eye, so what we should do? Like, do not rub the eye. It is the first thing we always do, that whenever we think that if anything falls in our eye, first we started rubbing. It is not necessarily done. So please stop it. Next, leave the upper lid over the lower and enable to lower eyelash to brush the particles out. Move the eye pro and move the particles out. Blink a few times to let the eye move and the particle out. Flush the eye with water, clean water, or use an eye wash solution to clean the eye. If it is particle remains, if then also the particle remains, then the eye close and seeking the help for the eye doctor or the ophthalmologist. You have to go to the ophthalmologist. Don't try in your house, because eye is a very important part of our body. Next, bleeding. So there are many kind of bleeding we can actually have. The firstly, bleeding can be life-threatening. So if the bleeding can go excessive, then it can threaten our life too. So immediate first aid is very much necessary. So first we are going to the external bleeding. What is it? Raise the bleeding part to reduce the downward flow. So first, if you had a cut on this, so we have to raise this part. In this way, we can stop the blood flow or reduce the blood flow because we are giving the against flow. Apply pressure on this bleeding part with a clean cloth or the cotton pad for at least 10 to 15 minutes or till such time when the bleeding not stops. So we have to apply one pad and we have to hold it like that to stop the bleeding. Do not wash the wound except the case of the dog bite. Only for the dog bite you can clean the area, otherwise do not wash. When the bleeding stops, apply some mild antiseptic lotion and then cover the area firmly with a clean bandage. If possible, also use some antiseptic bandage. It is easily available in the local shop. Next is nose bleeding. So whenever many of the cases we actually have this nose bleeding, it can be due to the lower water consumption. It can also for some allergic manner. It can also for some external injuries or internal injuries. Many things can be happen. So sit upright and lean forward to reduce blood pressure in the veins of the nose and the foramen of cloth. Use a tissue paper or soft cloth to soak the oozing blood. So we have to use the tissue paper on nose. Place an ice cube or cold compress around the nose. Finally, do not consume any drug without prescription. So we have a tendency like that whenever something happened, we have a tendency like we are consuming the medicines. We are having this medicines without the prescription. We all are doctors. So it should not be entertained. Like we have to go to the doctor or take a prescription written medicines and then we actually should have it. So in this way we can actually stop the bleeding and it is better. Okay. So in the next video we talk about the fractures, unconsciousness and swelling poisons. Till then, thank you.